Well, hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall, and welcome to this week's Exhibit Hall Flash Interview. This week, our guest is John Fryer. He's the Senior Vice President and National Head of Markets for Lumeris. And by way of introduction, Lumeris is a platinum exhibitor of the Value-Based Care Exhibit Hall, specializing in helping value-based care organizations with building and implementing population health services organizations. So John's here to tell us a lot more about Lumeris capabilities. And so in that regard, welcome, John.
John and the rest of the Value-Based Care Exhibit Hall team, thank you for having me. It really is a pleasure.
Well, I'm glad you could join us. And I just have a couple questions for you today. I think our listeners will find very interesting. One is, what exactly are the services or solutions Lumeris offers to help support value-based care organizational success? And then secondly, what sets Lumeris apart from other companies that seem to offer similar services? So if you can help us with that, that'd be great.
Awesome. Thanks, John. I'll start with a little bit of background and history on Lumeris for the audience and the role that we've played in the continued evolution towards value payment and care delivery models. Lumeris was founded more than a decade ago by a wily group of physicians who, after years of successful performance in a full risk Medicare model, they were determined to stand up their own value-oriented health plan for their patients. As you can imagine, with a group of physicians with no background in healthcare insurance, it was a wild early ride. But really, this plan continues to serve today as the sandbox for Lumeris and has ultimately grown to being one of the market's highest performing plans, with a 5-star rating and more than 70,000 Medicare Advantage members across 8 distinct geographies from really coast to coast. Wow. Out of this plan, Lumeris, a value-based care enablement company, was born that really serves to exist as a partner to those that seek to own, deploy, and administer a comprehensive set of capabilities to drive performance and value-based models of care. Today, we have more than 7,000 physicians, a little over 1.5 million lives, and more than $10.5 billion in medical spend under management across 15 markets from coast to coast. We operate multiple ACO REACH entities across 5 markets with more than 85,000 Medicare fee-for-service beneficiaries in our total cost of care ACO REACH model. What we bring to our partners is really a comprehensive model and set of capabilities for driving value-based performance, including a 365-degree patient-centric technology platform. So think about claims information, clinical information, social determinants of health information, labs, HIEs, and really many other data sources. People, so we deploy boots on the ground in all of our markets to provide leadership and oversight support, as well as clinical and practice transformation activities. And our proven role-based playbooks for how the provider network partners can actually take the information created by the technology platform and take those insights and turn it into actual actions that we can then execute on kind of across the continuum of care in the physician networks. Our partnerships are comprehensive in nature. So we are focused on all lines of business with our partners. So commercial, Medicaid, Medicare, direct-to-employer, value-based agreements. And we don't partner around just our technology or just our services as a standalone offering. We're really fortunate to have some of the industry's leading healthcare delivery organizations as partners today, and are constantly learning from our individual deployments and able to take those experiences from one market and translate them into success in other markets. So what I think really kind of sets us apart from other organizations in the space, to kind of get at your second question, is really our ability to deliver on end-to-end relationships via technology and data and knowledge, what's worked and what hasn't worked. You know, that's a big part of our partnership, is being able to take experiences that we have in other markets and not make the same mistakes twice, and our execution expertise to be able to enable our health system and physician partners to deliver value-based outcomes. Our business model is pretty unique. It aligns around our ability to succeed economically as an organization with our partners' ability to achieve the outcomes that we define as partners up front as we launch our relationships. And in many cases, it's structured to where Lumeris is actually sharing and participating in up and downside risk at the actual managed care contract level. Value-based care is not a new concept, as you, John, know more than most. And though the term has suddenly become one of the most in vogue trends across the industry at large, and many new entrants have kind of joined this space, and investment continues to pour in and hopefully accelerate this transformation towards value-based care. We at Lumeris have been focused on value-based care for more than 12 years and are committed to being the leading partner for organizations across the country as they continue to evolve their own journeys to a more equitable and aligned value-based model of care. We view the role that we play as a true operating partner aligned around achieving and driving value-based outcomes that will allow us to accelerate the U.S. healthcare delivery system's continued evolution towards a model where, in my opinion, we all feel like we've got a doctor in our own family.
Okay. Well, thanks, John. That was very informative and also very, very helpful. Lumeris's capabilities are certainly much needed at this time, as you well know. So for more information, folks, please visit the Lumeris booth in the Value-Based Care Exhibit Hall. There are some impressive case studies and other information in that resources section. You just click on that, and they've got some very, very helpful information there. So thanks to everyone for joining us, and a special thanks to you, John. Glad you could be with us today.